everybody. How's it going? It's been a little while since we're getting this new segment of another episode on the way of movement professionals. My name is Maiko Morotani. I'm the president of Nexus Motion, and I'm a lucky physical therapist who get to talk to some amazing physical therapists across the country in the US. And this evening, I am really lucky to be hanging out with Dr. Andrew Perino. Andrew, thanks for joining me.
Oh, I'm very lucky myself, so thank you.
Tell us where you are zooming in from this evening.
So I'm actually I'm out practicing in the Houston, Texas area. So I've been here almost a decade actually after moving from Los Angeles. So it's pretty much home at this point. So yeah.
Excellent. Excellent. Now, Andrew is a residency and fellowship trained board certified clinical specialist in orthopedic physical therapy. He also has a certified strength conditioning specialist as well. I am lucky in a sense that as I prepare for CEU applications for upcoming webinars and courses, I get to peek into people's CV. And let me tell you, this guy's CV is quite impressive. But one thing that caught my attention, Andrew, was that you are quite skilled in Taekwondo. Did you start Taekwondo early on? And these questions might lead to the follow-up questions that I have, but were there other sports that you did growing up?
Yeah, it's actually, martial arts had always been something I had wanted to do. And I actually grew up, I didn't really discover my sport until I was around 10, which was kind of late. And it was gymnastics, actually. So I had competed in gymnastics up until late high school, and ended up doing fairly well up at the like regional level, which is like 5 or 6 states. And I separated my shoulder like just before I think my junior year. I'm showing off doing like pommel horse stuff on on a wooden crate. But yeah, but that kind of set a foundation of really staying active and, exploring my body. So, I did a lot of rock climbing during college because I was up in the Washington State area. And I started thinking about, what, as I moved on in life, what I had really wanted to always, do and a sport I could do that would be lifelong and also one that I didn't need to rely on weather or a ton of equipment to do. And it kind of came back to the martial arts. And I was born in South Korea actually. Connecting back to kind of my cultural heritage was important. So yeah, so I actually started it pretty late. I started in my like about 20 years old, just before I graduated from college. And I just got really lucky and to get involved with the right people in terms of like coaches who had a lot of experience training it, not as just like a recreational activity, but as an Olympic sport. So when I moved to LA, I was able to train with the Villas, who were a few of the Mexico national team members, and then they linked me up with when I moved to Houston. I actually found Grandmaster Young Bong, who was the Olympic Mexico coach, now teaches here. So I train up with him now, but I've just been super fortunate to be involved with these people, and I always think about my life, and as much as I love physical therapy, I always think I never want to have one pillar in my life and nothing else to stand on, and I always want to develop myself in multiple ways. And I think Taekwondo has become one of those, pillars of my life that's it's become a huge part of my life, and I joke about as a backup career if I ever leave physical therapy, I'll be teaching Taekwondo. So, but yeah, so that's kind of my history with sports.
I doubt that you would need a backup plan, as I think you're doing really well in physical therapy. But I think what's the beauty of doing different kinds of sports growing up is it teaches you discipline, hard work, the work ethics, communication with other people, and also it sounds like you are very lucky to be surrounded with great coaches and people who mentored you. So that's wonderful in terms of growth as an individual too.
Yeah, no, thank you, Micah. So, and I think I think one thing that the theme, and we'll get to this later, is a lot of my coaches, regardless of their, academic knowledge level, the theme was never to embrace mediocrity and always, that every day is a chance that we learn from our mistakes and push ourselves forward. So I think if I got anything from sports, it was kind of always retro, looking back into myself introspectively and realizing what I could do better the next day.
So there are a lot of PTs who started with the sports track. They would go through some injuries themselves and sort of found their way into PT. What made you decide you wanted to be a PT? Tell me your journey from like college and maybe what did you do before you started PT school?
It was actually, my interest in movement actually started early on because I was a pretty sick kid to where like I went in because of pneumonia when I had recurrent pneumonia when I was a kid and I went into like fifth grade, I remember. And I had asked my mom if I was gonna die that winter because I was so bedridden, I lost so much weight. And I went into fifth grade at about like 50 pounds. And so when I found gymnastics, I really appreciated that ability to move and just the effect of movement on human health. So that had kind of been in the rear of my mind, and of course, like my AC joint injury, it was a pretty severe injury, like the rehab from that. And it wasn't really the physical therapist even, but it was one of the New Zealand strength coaches who'd worked with some of their Olympic teams who really got me interested in human movement. And then during college, really I actually grew up thinking I was going to become an artist, and I thought I was horrible at science, and I tried to avoid science like the plague growing up. And so it wasn't until mid-college I really thought about what was sustainable and what I wanted to do. And I was really interested actually in human psychology, and I was very interested in neuroscience as it was starting. Neuroscience didn't even exist when I was back in the late 90s in college, but I was very interested in like sensory and perceptual mechanisms and how our brain interacts with our body to perceive the world and interact with the world. So I was really split to where by the end of college I was leaning toward either going into some type of psychology or some type of movement based profession, and I think those two stood out to me because it was two of the few healthcare fields that really took multiple systems, physiologic systems, and integrated them together. And you had to really acknowledge the way those systems integrated to solve problems. And that was what was very interesting to me. So after school, I actually, I came out with a bachelor's in psychology with a focus on the sensation and perceptual mechanisms. And I actually went into strength coaching and personal training for about 3 years, where I ended up co-owning a studio with another colleague. And that was I mean, that to me was transformative because I actually during that time I read a lot of Florence Kendall's work, and I read a lot of I read the original Shirley Sarman and colleagues foundational book. And I didn't understand a lot of it at the time. But it was kind of interesting to me because a lot of the physical therapy or a lot of the personal training organizations like the National Academy of Sports Medicine were founded by physical therapists who had stepped out of the physical therapy field. And it was just fascinating to me with what this like with corrective exercise, like in a, they really stress the assessment for our clients and this corrective exercise. Just, one, how many clients had pain when they started with me, and then by the time they were done that they didn't have pain anymore. um, and I just saw at a high level how we could transform like human life by reteaching and training movement, which is really what sadly to me in this day and age, I think a lot of the very skilled strength coaches and trainers out there, they're the way they talk about movement and is at a much higher level sometimes than some of the individuals in the physical therapy field. And I really hope we can take the lead on that. So
That's amazing. I didn't know about those few years that you had actually owned the gym and were training people. That's incredible. So this next follow-up question kind of has already been answered a little bit, but so your journey went from getting your DPT degree from University of uh, Southern California, and then you went through the orthopedic residency program at USC, and then I actually, for those of you who don't know, I finally got to meet Andrew many years after he finished the Washington University Movement System Clinical Fellowship. I had been hearing about this guy for some time from the faculty, and so it was a real treat for me to finally meet in person at one of our retreats that we had. But it sounded like your journey to really embrace the movement system came on very, very early, like even maybe before physical therapy school, huh?
Yeah, I think my you know, like I never would have been interested in physical therapy if it existed as a profession when I had seen it in the 80s when, you know, we were doing ultrasound and, you know, isolate hot packs and like neuromuscular stimulation. But it was actually, you know, it was kind of like New Zealand, and I'm not sure how their structure works, but the coach that I worked with, and you know, the like how she kind of reshaped my body after, if you guys know that it's just gymnastics as a sport, you do incredible things with your body, but especially in the 90s, the actual science behind the strength coaching and the maintaining balance between the joints was absolutely awful. So I came out of that just biomechanically probably like a nightmare. And she really worked with me to correct a lot of you know, the various patterns that I developed that probably would have led to a lot of issues as I was going to get older. So yeah, physical therapy really like the, you know, even before going to school, I think because I had approached it from a strength and conditioning and you know, a movement perspective and appreciating how, you know, if we predispose, you know, if we sacrifice certain joints, you know, to certain stresses, they're going to cause problems. That the thing that always interested me in the field was what caused the underlying problems that people come in with in the first place. And that's really what I realized as a strength coach. I couldn't go into that direction. And I really wanted to go into the direction of, hey, like, I don't want to see someone necessarily to just get them strong, but how can I prevent them from ever going down the path of having pain in the first place? And then, you know, of course, I had the tools to get them to a higher level of performance as well, too. Um, USC, I actually got into Washington University and USC, and they were my top two programs to get into. And The reason I chose USC is just because I was so new and I had already read, you know, Dr. Sarman's work and Florence Kendall, and I felt like USC had a very strong biomechanics background, but it would expose me to a lot of different viewpoints early on, so I could kind of, you know, I could hear things that were contradictory to what I had heard and things that were in line with what I had heard and kind of make my own decisions about how I was going to develop as a clinician. You know, I went through the program and, you know, many of you know Chris Powers there and Beth Fisher, Cornelia Kulig, who won the ABTA, the Dedication Toward Biomechanics Award this past year at CSM. But they really, you know, throughout the program, like asked us to really understand human movement in depth and, you know, what's really driving dysfunction. And then it wasn't until residency really where they really encouraged us not only to do a differential diagnosis of the pathoanatomy, but really connect, hey, here's your end pathoanatomy, but I want you to explain, you know, in this case study that we had to do for our live patients exams, um, what led to this theorized pathoanatomy in the first place. So what's your underlying, you know, pathoanatomic diagnosis, but write about your movement diagnosis and the underlying movement patterns that predispose them. Um, and so Yeah, you know, I got out, I practiced for about 5 or 6 years, and I had originally planned to do the movement science fellowship at Kaiser. One of my good friends, Amber Rowe, had exposed me to that early. And that was really where I wanted to go. And it had gotten rolled into the spine and the sports fellowships, and that had gotten canceled by the time I was graduating. So you know, I was pretty heartbroken. I got at the same time I was pretty busy because I got a faculty position at USC. So I, you know, I put that on hold for a while, and then It was kind of a blessing in disguise where I had moved to Texas and I felt like I was 5 years out. There was still stuff I was missing. And it wasn't until I had a patient that I think I was seeing them for maybe 15 visits. And, I stepped back finally and I watched what they were doing when they did a sit to stand. And I saw this, like early, like right lumbar hyperextension that looked like it was causing their pain. And, I just cued them to activate their gluteals and their abdominals on the right, and their pain was much better just by me doing that. And I thought, if I had caught something like that 15 visits earlier, um, this patient wouldn't have been paying to see me and still been struggling for this through 2 months. So yeah, so that prompted me to really like start looking at fellowship education. And I reached out to Katie, Mary Kate and Susie, and kind of, after that, the rest was history. And that was kind of a dream of mine come true, is to get back involved with Washington University, because even though I hadn't interacted with a lot of those individuals, the concepts and the way that the I don't want to say philosophy, but the biomechanics behind the model of the movement system diagnoses were something that I'd actually been using, but I just wasn't using, the terminology you guys were using. So it was a kind of interesting, when I went to that first upper quarter course, I really realized that my upper quarter examination, it looked almost like kind of convergent evolution. It looked me struggling for 5 years by myself. It looked almost identical to what they were teaching. It's just like I had to just be a lot more mindful of what I was observing and what I was feeling during the examination. But that's kind of how it came about, and then and that's always been my passion. But kind of the rest is history after that. So.
That's great. It's almost like you came to a full circle because you were already
Yes.
getting well, and I think very few people pre-physical therapy would have been well read in the movement system textbook or Florence Kendall. So I think you were like miles ahead of many PT students. Now, as a I think of you as relatively well. I think we're pretty young
Yes. Yeah.
PTs, and yet you have an incredible amount of publications. You also teach and lecture while you're still a full-time clinician, which that's much respect on your time management skill. When you look back at all the things that you got to publish, do you have like a real memorable one or a favorite publication that's like near and dear to your heart?
Yeah, I mean, I have two. I think the one of the ones that, I always come back to is the 2017, I maybe foolishly had volunteered to be sole author of one of the AOPT monographs on neuromuscular tissue healing, which ended up being just this huge, like half a year ordeal in terms of researching like how we heal at a cellular level. But I think that really gave me an appreciation when I looked at movement macroscopically, what's happening on the cellular level. Like how do sarcomeres work? Like what techniques or what specific contraction types add sarcomeres in series? What's responsible for muscle stiffness? Like all these things that we, on a macroscopic level, as physical therapists, we almost don't want to think about a lot of the time. Um, and it also just got me thinking in terms of later as I continue to develop, if someone should be healing at a typical rate and they're not necessarily healing, they're not where they should be, do they have an underlying like movement system syndrome that's like it's not necessarily this chronic adaptation, but do they have this are they developing this movement system syndrome that's preventing them go through this neat phase of healing and slowing their progress down? So I think that was a has always been a pivotal like set of knowledge that I just didn't appreciate before. And I didn't appreciate when Rob Landell at USC said we needed to be better immunologists as physical therapists and understand the immune system much better, until I really understood the whole healing cascade and all the factors that can affect healing. I'm in those initial phases. So, and then I think more recently at the macroscopic level, my colleague and I in 2012, we had a adolescent pitcher, and he had come in, and yeah, he actually had signs of he was getting little league elbow, and he was starting to get signs of apophysitis at his medial at his ulnar collateral ligament region, and he'd been seen in PT before, and we really looked at him, and his symptoms were with batting, and it really looked like when he batted, he supinated his or he externally rotated his humerus so much on the trailing limb when he hit the ball that he set himself up for this valgus force. So we really, I spent a lot of time. I looked at his shoulder, and we ended up really working on his mechanics and separating the concept of forearm supination versus humeral external rotation, and we never touched his elbow, and that's really what got him back to. That's what got him back to baseball. And I confirmed, a couple of years later, it's never been an issue again. So I mean, that type of stuff is fascinating to me. And that's what makes going to work fun every day versus the just, staring at a isolated joint and, making decisions about just one body region. So
Whenever we have conversations, this is my impression that you are just super well read in the literature out there, and I just wonder, like, do you just have all kinds of like clinical questions floating in your mind at all times, or did writing these like monographs really help you dive into all these, reading the most updated articles?
I think like a great place to start, and it's kind of the opposite of what a lot of people will say is I always tell my students, my residents, if you're interested in a topic, start with a lit review and not a systematic review, because you kind of get a bird's eye view of the topic in general and where people stand if it's from a high quality journal. And I think it was, I got exposed to some literature in school that got me thinking about. I actually had to present for the faculty at a seminar on interventions that altered muscle stiffness versus muscle shortness. And it was the first time they had a DPT present at a PhD seminar. So I talked about static stretching and the lack of effect of on actual muscle stiffness, which is kind of what Shirley had talked about yesterday. But that got me the tools, I think, to start really appraising literature. And then something really stuck with me during my program that Rob Landell had said, like if you calculate your commute time every day, that's a chance to really like dedicate that to growth throughout the year. And I think I recently calculated my commute time, and I spend something like 36 8-hour days per year just driving, which is just insane to me. So I
Wait,
think
is that in Texas time or is that in Los Angeles? Because I think that's
this
a
is
big.
in Texas and Los Angeles. It was even longer, I think. But yeah, I spend a lot of time in the car. So usually, what I do throughout the week is I've just made it a habit. Is every day, I think about the patient. I'm like, hey, what did I do really well that I can reinforce the next day? And then what questions do I have, or where do I feel that there are gaps in my knowledge, or which people weren't getting better? And I just think of one clinical question on the way home that I have for that individual, and then I might just pull that that evening I'll usually just pull maybe one or two articles, and I might read like five articles a week just focused on one or two clinical questions, and but like I think this I've gotten I have a subscription to Speechify, which takes any PDF and it'll read it out loud to you, which I use while I'm driving actually. And so I've been able to use that even, I say like my commute's in the morning, like if I'm tired, I listen to just something fun, I listen to music, but if I'm refreshed on the way home or vice versa, I play the article that I downloaded, or I read, I listen to it. And so I think it's made it part of a habit that's enjoyable and not arduous to me. And I think um, a lot of during our curriculums they don't emphasize that, just like movement analysis, just like teaching, like being able to appraise an article is a skill, and if we never use that skill at all, it's very very hard to get better at it. But I think because I've made it a regular part of my life, I've gotten to the point now it's not emotionally, mentally taxing, and I can really quickly parse down the article to what's important, and if the methodology was good, and then implement into practice. So
Oh, I'm just taking down all kinds of notes here. Thanks, Andrew, for your tips. So, and for those of you listening too, and this is how you can like really boost your time management and get a ton done and yeah, be a lot more knowledgeable. I think just our learning just should never stop. Unfortunately, many people after they graduate from school, it's like, okay, that's it. Like I got my license, but really it's
yeah,
like we're just getting started from that point. So yeah,
yes.
thanks for those tips. That I'm gonna have to get on. Although I don't have very long commute times, but I do live in LA, so that's what's going for me. We have heard several different names come up, but uh, which individuals really influenced your physical therapy career the most?
I mean, first think, like Femke Cohen, who was the New Zealand strength coach. She really influenced me because she was the first one who showed me that, human movement can be something more than, it involves a thorough assessment, a very systematic, thorough assessment, and it involves, addressing multiple concepts at once instead of just taking a person and, putting them on a table and stretching them passively. And I think, a lot of
how do you spell her name?
uh, it's Femke, and then last name is Koene. And I believe she's back in New Zealand now. She was just in the States for a little bit, and I got the pleasure of working with her, but now she's back in New Zealand. And then I think a lot of my of course mentors came from the physical therapy program, and specifically residency was where I really felt like I actually became a clinician. And I think Mike O'Donnell, he's one of the old school fellows of the American Academy of Orthopedic Manual Physical Therapy, and just being able to talk with him about the spectrum of where we were, just like Shirley, and where we're what we've evolved into and where we're headed. And he was actually the first person. That's very interesting coming from a manual therapist that he asked me during our mentorship one session. He said, so what does a joint feel like when you're assessing it? And I said, it feels hypomobile and painful. And he looked at me for 1 second. He says, hypomobile? And he's like, because it should be hypermobile and painful. And that was the first time I think it finally clicked in my head that manual therapy made sense, is like your relatively hypermobile joints are going to be painful because of nociception, and not you're just not trying to. So he actually, he really encouraged us. And as we went through residency, it's like, use your physiologic observation, but like your painful joints are the ones that are moving too much. Um, and he also really reinforced that the old school, he was friends with Olaf Advanced, who was like one of the original manual therapists. And he would tell me stories about how he would point to like a cobbler back when cobblers were a thing, and say like that cobbler is never going to get better, and he's never going to get better because he's always making shoes with that same pattern, that same movement pattern. So I think there's been a lot of division, within physical therapy where especially with the pain science paradigm, I really fear people have gone too far in one direction. But I think he really kind of gave me a perspective of where the profession came from, and kind of helped me appreciate some of the core like foundational principles that I think apply regardless of who you're trained by. That we can all agree on that how someone's doing something is very important. And I think the manual therapy concept that your painful joints are hypermobile, except in the case of something that's like an autoimmune dysfunction like adhesive capsulitis, is a very powerful paradigm that makes even the students that I connect with or my residents, it finally makes sense to them when we talk about it in that framework. So, um, and of course, many more, but those are the two that really stand out to me.
Thanks for that. I'm always so interested in learning about people's beginning of the journey, like, and what they've been doing, and certainly where they're headed. And Andrew, I really appreciate you're the kind of person who like is always thinking about, well, why is that? How come? And you're always trying to get to the root of it instead of just taking as is and then doing the same things over and over again, which is really easy to do in this day and age where productivity is on high demand. We gotta get so much done. So I commend you for always thinking through and continuously growing. Um, Next week, it's I don't have very much time to edit this video, but I will get it done. And
No, no.
uh, we are I certainly am excited for the May 1st webinar. It's the Upper Quarter Movement System Syndromes Foundation webinar series, and this is the third one in the series. What can we look forward to during your webinar on May 1st?
So, so I think I have to give one more credit of a very influential mentor, which is Dr. Kulig at USC, because she had really told me to early on that we have to always look at things through multiple lenses, and she had taught me to really be open-minded in my career. But I think she really gave me the concepts of biomechanics and understanding material properties of tissues. So I think what you have to look forward to is hopefully, it's full of animations. Biomechanics is, a visual medium, and it's easy to take for granted that a lot of us, unless we've been in an anatomy lab or we've seen a lot of these animatics of, a fluoroscopy study or like, a reconstruction on computer modeling, it's hard to really imagine what's going on in the human body when we talk about these concepts like anterior humeral glide or like the scapula internally rotating on the humerus when someone does a test. So I think I really hope to just bring the general concepts of relative stiffness of muscle tissues, the relative flexibility of joints, the anatomy and the kinesiology of the shoulder girdle and how it interacts together to life. And it's hopefully something that participants are able to use with their patients, but also going forward as they get into other material and hands-on material, they can imagine these animatics as they're actually working with live bodies. So
Yeah, I did get the preview of it and it looks incredible. So that's part of my excitement too. I know that,
thank you, Micah.
yeah, as part of the courtesy of Washington University physical therapy program, um, anybody can get access to Cheryl Caldwell and Renee Ivans' scapular and humeral movement system syndromes lecture. That's all available for free. It is very dense, and sometimes we just want to see a little bit more about like, well, what's happening? I want to be able to picture which way it's going, and I believe Andrew's presentation next Wednesday is gonna just do it for all of us. So I look forward to it, Andrew.
I really hope so. So, but thank you, Mike. Thank you, Micah.
Yeah, it's I'm just gonna sit back and take notes and have lots of fun, and I hope you will do the same. Best wishes on your health and recovery, and
Thank you.
it's been a pleasure hanging out with you this evening. Thank you so much for your time.
Oh, likewise, likewise. Thank you so much for your time, Micah, and enjoy your trip.
Yep. Thanks so much, Andrew.
Take care, and I'll see you next week.